Hello, everyone. Thank you for joining us tonight. I'm Hannah Collins, and we're here with Dr. Espinel discussing Hernias, a simple solution webinar. I'm going to go ahead and introduce him, and then I'll give him the floor. Dr. Espinel is a board-certified general surgeon. He earned his medical doctorate from Universidad Católica Santiago de Guayaquil in Ecuador and completed his residency in general surgery at St. Barnabas Medical Center in Livingston, New Jersey. Dr. Espinel completed a fellowship in minimally invasive surgery at Bay State Medical Center in Springfield, Massachusetts, and now performs robotic surgery. Dr. Espinel enjoys working for Tanner, where he practices at Carrollton Surgical Group in Bremen, Carrollton, and Villarica. Dr. Espinel, whenever you're ready.
All right, let's do this. All right, well, good evening and thanks for joining us in this simple solution webinar about hernias. It's a topic that I really enjoyed, and I thanks Hannah for the introduction. She said I'm Dr. José Espinel, a general surgeon with a fellowship in minimally invasive surgery with a lot of interest in performing surgeries through little incisions, and we'll talk about that later on. So one thing that to keep in mind, if you want to make some questions and do some questions through this whole talk, we'll go over them at the end. But there's going to be a purple button where you can ask the question. Once the box appears, you may type your name in the name field and then ask your question. If you do not see the questions and answer box, please look at your top right corner for the button highlighted below. All right, so hopefully we can answer some of them. All right, so let's first start talking about what is a hernia, okay? A hernia is when an organ, that it could be the intestine or fatty tissue, squeezes through a hole of a weak spot in the muscle or tissue. It can be located over the abdominal wall and also over a muscle called the diaphragm. This is the muscle that divides the chest cavity from the abdominal cavity, and these are the famous Hydra hernias that we'll talk a little bit about too. So these hernias, when they are in the abdominal wall, they can be visible as an external bulge that are experienced when people are straining or bearing down. And you can see a picture there, kind of explain you how the hernia looks. So then we need to talk about the types of hernias, okay? And we have to make a differentiation here about abdominal wall hernias and hiatal hernias. The abdominal wall hernias, they are named, or their name comes from the location where the hernia is originating from. One of them would be the umbilical hernia. The umbilical hernias are hernias that arise in the belly button. Then the other ones are called inguinal hernias, which are the ones that are localized in the groin region. Then we have other hernias called incisional hernias, which are hernias or protrusions that come through a previous incision, so a previous surgery that you had in the past. Hydra hernias, though, in the other hand, you can't see them as a protrusion. I explained you before that the hiatal hernias are a protrusion of the organ, which most common is the stomach that goes through this muscle called the diaphragm that divides the chest cavity from the abdominal cavity. Once that hole called the hiatus becomes big, then the stomach, which is localized in the abdominal cavity, goes up into the chest, and that's what is called a hiatal hernia. Here's a picture of a hiatal hernia just to give you an idea. There are different types. We're not going to get into that detail, but you can see there in that picture in the middle, that big hole is the hiatal hernia, and inside you can see part of the whole stomach and part of also the intestines. So hiatal hernias can get very big. So then what causes a hernia? Well, it's a combination of factors. It's multifactorial, but definitely an increase in pressure in the abdominal cavity in this case, and weakening of the muscles in the connective tissue are going to predispose somebody to have a hernia. Sometimes these hernias are seen at birth, or more commonly, they are seen after life. So let's talk about some really specific causes of hernias. Like I said, it's multifactorial. You can see several things in here. Definitely obesity plays a big role. What I usually tell patients, the abdominal cavity is like a suitcase. If you put a lot of clothes inside a suitcase that you're packing to go for a vacation, for example, and you overpack it, can you close the luggage? Yes, you can, but it's going to close pretty tight. At one point in time, if you drop the luggage, then it'll probably open and burst open. Obesity is kind of the same. If you put a lot of visceral fat inside your abdominal cavity and you got a weak spot in the muscle, then at one point in time in life, that weakness becomes a hole and becomes a hernia. Lifting heavy objects, that also is going to increase your intra-abdominal pressure and the pressures in the muscles. Things that cost you constipation, increase your pressure in the abdominal cavity. Persistent coughing, sneezing, people that have COPD, chronic asthma, that also increases the pressure in your abdominal cavity. Poor nutrition, for sure. If you have somebody that is poor nutrition, then you're going to have weak tissue and more prone for having a hernia. Smoking, it's a known factor to cause a hernia. We'll talk a little bit about it as well, but smoking actually is a known factor for recurrent hernias. That means that we fix a hernia, and because of the smoking, then the hernia can come back. And so smoking is not good. Pregnancy, again, you're increasing your pressure inside your abdominal cavity. That will cause a hernia. And overexertion of a weak muscle. So people who do a lot of lifting or jobs that have to do a lot of movement of the muscles, they can cause a hernia. So then the question is, what are the symptoms? How do we know that we have a hernia? So you're going to start, depending on the area of the hernia, you're going to feel a bulge. If it's in the groin area, like we're mentioning in the first part of the slide, you're going to see a bulging over the groin or even over the scrotum in males. You can also have a burning or aching sensation where the hernia is. You can have pain and discomfort. And the other part that you can see is you can see a weakness or a pressure sensation over the hernia area. Now, these are, if you notice this, these are all related to the abdominal wall hernias. Hydra hernias are different. The ones that are the communication between the abdominal cavity and the chest cavity. People with Hydra hernias, they usually have more reflux symptoms. So people can have heartburn, can have difficulty swallowing, can have regurgitation when the food comes out. So that type of hernia has specific symptoms. So how do we make a diagnosis? Once again, we have to separate these two hernias that I'm trying to make a compound explanation here. The abdominal wall hernias, the ones that are in your belly area, it's basically diagnosed with physical examination. You can use your finger, the doctor, the surgeon, or a primary care doctor, and they'll find the hole between your muscles. And you, when you're pressing where the hole is, then what we do is we tell the patients to recreate a Valsalva maneuver. What is Valsalva maneuver? We want you to increase your pressure in your abdominal cavity by coughing or straining, and then we put our finger in the hole, and we should feel that herniation or that protrusion of the organ through the hole. That's how we make a diagnosis. Hydra hernias, on the other hand, because they are not visible in the outside, they require further tests to be diagnosed. One of the tests will be an upper endoscopy. You go, your gastroenterologist, majority of the times, will go down into your stomach, and they can actually see the Hydra hernia. And the other very common way to make a diagnosis is through a special X-ray called the barium swallow. Barium is a thick contrast that you drink. They get some X-rays, and they can see that your stomach is in your chest instead of being in your abdominal cavity. So then we go into through the surgical treatments. How we can fix hernias? Unfortunately, there's not a magic pill that a patient can take and will close the hole. There's nothing like that. The only way to fix hernias is through surgery. Now, there are different techniques or approaches to fix hernias, and we're going to go from the more aggressive one, which is an open repair, when we make a big incision, or depending on the area, smaller, but make a longer incision usually. And we go and find the hole. We push everything back that comes out of the hole inside your cavity. And then we have two options. We can put sutures only and repair it, or we can put a piece of mesh, which is usually polypropylene, which is plastic. So that's the open repair. And then we come into the newer techniques that are called minimally invasive. What do we mean by minimally invasive? Instead of making big, long incisions, we make little incisions to fix the same hernia. The way that I explain to my patients to make a difference, or how to understand the two techniques, is I go back into how to fix flat tires. Flat tires in the past, at least for me, and if we have people who are older here in the audience will understand and resemble, as Hannah told you guys at the beginning, I come from Ecuador, which is a developing country. And in those days, when I was a young kid, the way that they used to repair tires is by patching it from the outside. So they'll put some rubbers in the hole of the tire, then they cut them flat, and they put an iron and melt the rubber in the hole. And that's how they fix the tires at that time. The newer techniques to fix a flat tire is they don't put any rubbers in the hole. The hole. They goes from the inside of the tire. They find the hole, which is usually very tiny from the nail, and they put a patch that is that big to fix the hole. That is the way that I kind of explain my patient how to do an open repair and minimally invasive repair, so little incisions. So then we have, and we're talking about the laparoscopic repair. You make little incisions, you go inside the belly cavity, you push back all the hernia content, your intestine, whatever is stuck in there, and then we put a piece of patch. And the difference between laparoscopy and robotic surgery is little incisions as well, but the equipment that we use to repair the hernia is called a robot. And we have it back over here. It's called a Da Vinci robot. What is the advantage to this is that if you see those arms of the robots right here, okay, we put some instruments in here that we attach them, and the surgeon sits on the console that is on the side, and with some joysticks, we guide those instruments to make the repair. And the difference is the arms of the robots, when you put your hands in there, they have more rotation than the human wrist. So you are basically putting your hands inside your abdominal cavity, the patient's cavity, and you're allowed to perform more precise surgery. So what is the difference between all these techniques? Well, an open repair, because it's a bigger incision, it's going to have more pain. That means they're going to have more downtime after surgery to go back to work. And one of the things that we recommend is not to lift any heavy objects around 30 pounds for 6 weeks. So you're going to be, if you're working in construction or a lot of heavy lifting, if you do an open repair, you're usually out for 6 weeks of no lifting. The laparoscopic and the robotic approach, because we're making new incisions, then it's less pain, less chance for infection and mesh infections. And because we can put a bigger piece of mesh to cover the hole, then the downtime of heavy lifting is only a week. So those are kind of the difference of these techniques. Now, this is where we're talking about abdominal wall hernias. Let's talk a little about fixing Hydra hernias. This is kind of the same principle there. There's some cartoons that you can see there. The first cartoon in your left upper aspect, it shows that diaphragm muscle that I was explaining to you with that big hole in there. And in the second cartoon, you see how there's some sutures in there that are bringing those muscles together. The two bottom pictures are basically live patients that I've done before, where you can see the hole in the bottom left part. And on your bottom right part, you can see that that hole has been closed with some stitches in there. Fixing hiatal hernias is a very complex surgery that definitely requires very detailed dissection of the tissues and putting tissues together. And this is where the robot is a big plus. Like I said, the robot allows the instruments to articulate more than the human wrist, so you can really do precise surgery. This is a picture, just, you know, you have it back here in my background kind of live. On your left side of the slide, you can see the surgeon sitting in the console. That's how you control the arms of the robot that is on the left side, and that's the operating table where the patient lies down to undergo surgery. And on your right side of this slide, you can see the robot a little bit closer. So we all want to prevent instead of undergo surgery, and I think that is very wise. So if you ask me what I can do to prevent surgery, there are some factors that you can prevent, right? There are some factors you can. For example, genetics. There's some people that have just weak muscles, and their father had a hernia and their brother had a hernia. So those things you can't change. But definitely there's other things you can change. And we talked about it, maintaining a healthy body weight. We talk about obesity. Obesity is not good for a lot of medical reasons, and hernia is not the exception. Avoid constipation. We're talking about if you create a lot of pressure in the abdominal muscles, then a weakness can become a hole. So eating high fiber nutrients or foods, so vegetable, whole grain foods. And once again, this will improve your constipation, but as we know, fiber also decreases cholesterol. So eating a lot of fiber is good. Use the correct way to lift heavy objects. If you are working construction, right, and you have to lift things are, you know, I will say over 50 pounds. Well, find some help. Get 2-3 people how to help you lifting heavy objects. And the other one that we talked about that causes tissue to become weak and not healthy is nicotine and smoking. So don't smoke. Once again, not only because you can prevent a hernia, but you can prevent a lot of other medical conditions. So I hope that you enjoyed this lecture. This is really for educational purposes for the community. Make it short so you guys can stay tuned, and I am here to answer any questions that the audience have. Thank you very much for your time.
Dr. Espinel, you did have a couple of questions come through. Your first one is asking, why might a doctor tell me there's no need to do anything when you first find a hiatal hernia?
Okay, so that's a good one. That's a good question. So if we start getting a little more into when a hiatal hernia needs to be fixed, and so there are really 4 types of hernias. One is called a sliding hiatal hernia, which is the type 1, which is the smallest one. Sliding hiatal hernias, if they don't have any symptoms of reflux, no heartburn, no regurgitation, no difficulty swallowing, no coughing or hoarseness, those hiatal hernias, which by the way are the most common ones, 90% of hiatal hernias, 90 are the most common type of hiatal hernias. And majority of hiatal hernias, if they don't have any reflux symptoms, you don't need an operation. So most likely when your doctor tells you, oh, you have a hiatal hernia, don't worry about it, don't get it fixed, most likely it's a type 1 hiatal hernia, and that is asymptomatic.
Okay, and then another one is it true that a hiatal hernia is sometimes caused by obesity?
If the hiatal hernia can be caused by obesity?
Yes.
Yeah, absolutely. So when I talked about the causes of hernias, that was general for both of them. And obesity is definitely one of them. What happens is when we start getting overweight, we start making a lot of deposit of visceral fat. So we all human beings, we have fat pads inside our belly cavity. We got a big one that is called omentum. It's like a fat pad that is covering all our guts. If we start gaining weight, one of the first places that we deposit fat is in there, in the visceral fat. The more visceral fat that you have is going to increase your intra-abdominal pressure. If you increase your intra-abdominal pressure, the hiatus, that is a hole that is supposed to be, I'll say, just that big, it can become that big. And when the hiatal hernia occurs, the disadvantage that we humans have is that the chest cavity, which is on top of the abdominal cavity, is actually a negative pressure cavity. So every time that you breathe, is actually sucking up whatever organ is in your abdominal cavity. So if your hiatus gets big, you have a lot of fat, your pressure in your belly is higher, and your pressure in your chest is negative, what it's going to do is every time you breathe, it's going to start sucking an organ from the belly cavity to your chest cavity. Which is the first organ that is in your abdominal cavity? The stomach. So that's why the stomach is the first organ that goes up into the chest when you have a hiatal hernia.
Thank you, Dr. Espinel. Somebody else also asked if my 14-year-old had inguinal hernia surgery at age 2, and she is complaining of some slight pain in that area now. Is that cause for concern?
Absolutely. So when not only a 14-year-old, any age, have pain in an area that a hernia has been fixed, especially in the groin or any place, but in the groin in particular, because this is one of those areas that tend to hurt. The first thing that needs to be evaluated is to be sure that there's not a recurrence of a hernia, because hernias can come back after they get fixed for a lot of factors as well. So recurrence, that is called recurrent hernia. One of the signs of a recurrent hernia is pain. So if somebody has a pain in a place where the hernia got fixed, then I will encourage that person to visit, could be your primary care doctor or could be a surgeon, to be evaluated and confirm that the hernia has not come back. Now, there are other causes of pain over a previous hernia site. For example, inflammation of the nerves that are in the surgical site. So they call what we call neuromas. So inflammations of the nerve, they can cause pain in the previous hernia sites. So those are the two most common reasons, but definitely that patient needs to be evaluated to confirm that he has not, or he or she has not had a recurrent hernia.
Thank you. And then the last question is, do you do the TIF procedure, and is it effective as the robotic one?
Great question too. So a lot of hiatal hernia questions. I like it. So a TIF for the rest of the community is an acronym for transoral incisionless fundoplication. Okay, gets fancy, right? So that type of surgery is done for reflux surgery. And I just told the audience that a lot of the symptoms of hiatal hernia is reflux. So in this case, the person is asking is, I'm having reflux. Is the TIF a good thing to do, a good option to perform? Well, TIF is a less invasive option for reflux disease, but you have to qualify for that. So there are some indications to do the TIF. And their indications are that the patient has to have, can't be obese, one, and number two, can only have a small hiatal hernia. Hiatal hernia less than 2 centimeters. In those cases are the very uncommon patients. A lot of the patients that have a hiatal hernia and they have reflux, the hernias are usually pretty big. But if you qualify for them, that could be an option. There are papers out there comparing TIF with robotic fundoplication. That's what she's asking. And they have very good results, but you have to be the right patient. And unfortunately, I don't do TIF. This is something that I have elected not to perform. Those are usually performed by gastroenterologists.
Awesome. Well, Dr. Espinel, that was all the questions that came through, but thank you for joining us tonight.
All right. Well, thank you very much. And I hope Carrollton community, or I don't know, probably people from even farther out have learned a little bit about hernias. Thank you very much.
Thank you all for joining us tonight as well. Please continue to check out our classes on Tanner.org, classes and events for other informative topics, and I hope you all have a great evening.